Welcome everybody, and thank you for joining us. What sadly is our last webinar for 2020, but hopefully it's going to be a very useful and practical one for the clinicians that will be watching. My name is Jim Hunt. I'm a nurse educator here at Insight. Before I begin, I'd like to acknowledge the traditional owners and custodians of the land on which we're presenting today. I'd like to put forward the respect and welcome for elders past, present and emerging, and I'd like to extend that welcome and respect for any Aboriginal or Torres Strait Islanders that might be joining us out there in webinar land. So thank you and welcome. As I say, it's our last one for 2020, and I thank everybody for joining us through what's been a fairly interesting year. We've tried our best to try and provide the webinars for you, and hopefully they've been of use. And as I said, I think today's is going to be a very practical webinar. We've got Mary Crofton, who's an oral health therapist, joining us today, who's going to be presenting about how substance use can impact oral hygiene and how it impacts on people's dental health care. And I think we all know, people that have worked with the clients that come through the door, the impact that this can have on somebody's morale and somebody's confidence. So I think it's going to be a useful topic and something that hopefully we can start to implement some changes that might help improve the outcomes for our clients. So I'm looking forward to what Mary's got to say. So without any further ado, I'm going to hand over to Mary Crofton. So thank you, Mary.
Hi, everybody out there. I would like to acknowledge the traditional elders on the place in which we meet, past, present and emerging. So a little bit about myself. Yes, I'm an oral health therapist. No one knows what that is, so let me help you with that. I'm a dental practitioner, but I am not a dentist. I am a hybrid, dual qualified in dental therapy and dental hygiene, in that I do clinical dentistry, but I am focused on prevention and not the filling. Oral health therapists provide a wide range of dental care in a variety of settings to children, adolescents and adults. Oral health therapists work as a member of the dental team. This qualification is called a Bachelor of Oral Health. We are focused on the cause and education of disease and the links between oral and overall health. I have advanced skills in the treatment of periodontal disease or gum disease, special needs and cancer care. I worked with the specialists and dentists at the Oral Health Centre in Herston Metro North in alliance with the University of Queensland Dental School. I do not make dentures, do root canal therapy or oral surgery on adults. And no, I didn't grow up wanting to work in dentistry. I was actually enrolled in communication at university, which as an avid art student was exactly where I wanted to be. There was a recession on, and my father somehow convinced me, I must have been hypnotised, to do dental therapy, as there was a guaranteed job at the end of it. Briefly, I graduated as a dental therapist in the 1980s and worked for 10 years in a school dental program in a dental van throughout Brisbane. This involved doing paediatric dentistry on children aged from the very young to 18. In 1980, I resigned to move to Alice Springs with my now husband, who was working as a lawyer for the Aboriginal Legal Service. This changed my life, my outlook, and my whole way of looking at the world, as I saw the inequity, the poverty, and the racism alive and well in this town. I travelled to very remote communities and was struck by the strength, humour, and knowledge of our First Peoples. And for the first time in my life, found myself in a place where Black people outnumbered white people. The other thing I saw, sadly, amongst some First Peoples were the ravages of drug addiction in both the adult and child population. Chroming, or paint sniffing, was taking a terrible toll on young children. I returned a year later to Brisbane and again worked in the children and adolescent program. In 1994, we moved to Kalgoorlie, Western Australia, the grand old mining town, or the Wild West, as I like to call it. I couldn't get a job in dentistry, so I ended up working in the local pharmacy as first as the toothache consultant, and believe me, there was a lot of clientele. It was a young population like myself, most under 35. It was a little bit like the town of broken dreams. Many came wanting to make their fortune, but the long hours and the danger meant a lot of money got drunk or smoked or injected away. I always remember coming to the back of the largest pharmacy to find so many used needles lining the laneway behind the store. Then I came into contact for the first time with former addicts who are now leading very normal lives thanks to methadone and would come in daily for their medication. I was struck in my ignorance how normal these people were, often with children, and wanted to know what happened. How did these lovely normal people get addicted? I have always been very interested in prevention rather than cure. In 2006, I undertook an additional 2-year course to become an oral health therapist, which means in layman's terms, a dental hygienist and a dental therapist combined. This meant that I now could start treating patients in the adult age bracket from 18 up. So I now find myself working in both programs, which gave great perspective on changes from cradle to grave. I immediately started working at what was the Brisbane Dental Hospital in Turbot Street. I then started meeting patients in rehab from Munya in Red Hill. These patients all had special needs and needed a lot of rehabilitation of their ravaged mouths. It was like after the addictions were gone, they were left looking at their ravaged mouths and desperately wanted to look normal, and most of the time needed dentures or at least partial ones. First, however, came the knowledge which I needed to impart to stop more damage occurring: smoking cessation, oral hygiene education, and dietary advice. These patients were desperately trying to get their lives back together in every sense, and one of their greatest obstacles was trying to get a job. What stood in their way was their appearance, and by that I mean their lack of teeth. They didn't want to smile, and mentally this affected them very deeply. So now, 14 years later, I find myself doing what I always wanted to do, which was to communicate and educate my patients compassionately and give them the tools to obtain better oral and, as a result, better overall health and a better life. So now it is with my great pleasure to help you as alcohol and drug advisors and clinicians understand the effects on the oral environment of drug abuse and addiction, and answer any questions I can in order to help you. Okay, so we're going to move to our first overview. My talk today is oral health and the impact of alcohol and drug use on the oral environment, or as I like to call it, shame about the smile, which is a shame about the smile and also the shame that comes from the smile. So that's, for me, very important as well. So let's begin. So an overview of what I'm going to talk about today includes oral health and the oral cavity, the importance of saliva, the direct and indirect consequences of alcohol and drug abuse, oral conditions and pathologies associated with drug and alcohol misuse. These include opioids, stimulants, cannabis, alcohol and tobacco, some issues for Indigenous and younger people, and most importantly, supporting your clients, general oral health advice, a referral pathway, and references. So here's a picture of someone sticking their tongue out. Or more importantly, I just wanted to go into some of the obvious structures of the mouth. When we think of the mouth, we often just think of the teeth and the gums, but there's a lot more to it. And when we're looking in someone's mouth, we are obviously looking at every part of the mouth. We start with the top lip, and there's beautiful looking teeth. Then we'd look at the hard palate, which is at the anterior of the mouth. and the soft palate towards the back of the mouth. We also see the uvula, tonsils, the buccal mucosa or lip and cheek lining. And underneath the tongue, we've got the floor of the mouth, and then we've got the front 2/3 of the tongue. Now that is a textbook mouth. On the right, you see a slide of a tooth and a root in the gum, and there's a little measuring stick, because when we're looking in your mouth, we're checking every structure in your mouth, not just your teeth. We're looking at the soft tissues, your tongue, all those areas we're checking. We're also looking at your gum health, and we use a little tool called a periodontal probe. Now you can see on this beautiful tooth here, which is intact without caries, you should only be able to push that probe maybe 2 or 3 millimeters into the gum. If you can push it any further than that, and this should happen at routine dental examinations, then there's something wrong. And I'll talk about that in later slides. So here we have healthy teeth, healthy oral health tissues. And by that, I mean that the color, if you look at the gums, they're pink, they're firm, they're moist. There's no red or white swollen tender areas. The teeth are firm. That means they're not mobile. And they say no flaps, pockets, or recession. Well, if we go back to the former slide, a pocket is what we're looking at when we look at that slide there. If we can go further down than 3 millimeters, you have what we call a pocket. So your gum should be very close to your tooth and it being adhering well. So that's something we look at. We're looking for strong teeth, we're looking for restorations that are not broken. We're looking for pleasant or neutral breath, and we also look at proper jaw alignment and tooth spacing. Obviously, crowded teeth, like the third slide, are much harder to keep clean, and it also can impact on the ability to chew and therefore digest. The tongue, as you can see on the last slide, is very healthy. It's pale pink in color, it's smooth, it's moist, it looks good. So that's what we're looking for when we're looking for a very healthy mouth. Now comes the most important part of that equation, which is saliva, or the Superman of the mouth. So you never miss your water till your water runs dry, okay? So saliva is it. Saliva is essential to oral health. If you don't have saliva, you don't have immunological protection, you don't have a buffering capacity, which means that your mouth remains neutral. If you want to think about it, your mouth is a unique environment. And when it's in balance, when everything's working properly, it's alkaline or neutral. And this is what favors healthy mouth and healthy tissues in the mouth. So an alkaline mouth is one in which you don't get holes in your teeth because your reservoir of buffering capacity, you've got lots of good saliva, and that buffering capacity, when your mouth becomes acidic when you eat, it very quickly, if you like, neutralizes the acidity in your mouth. Now, this is dependent, of course, upon what you put in your mouth. And what you put in your mouth is an indicator for what goes wrong, because everything starts in the mouth. So as well as helping swallowing, talking, and taste, it's the protectant or the warrior of the oral environment. The washing action helps prevent bad breath and caries. And unfortunately, the quality and the quantity is very much affected by drug use, both prescribed and illicit drugs. So there's many drugs that we all take every day that can cause dryness of our mouths. So, for example, there's a whole list of drugs here. So these drugs, often antidepressants, antihistamines, anti-anxiety, antihypertensives, anything with the word anti in front of it normally has, as a side effect, unfortunately, a drying effect on the mouth. So when you have a combination of these drugs working in a synergistic activity, this means that you can end up with an extremely dry mouth. And this includes alcohol, cannabis, tobacco, anti-HIV drugs as well, selective serotonin, all those antidepressants, they can have a big impact on the quality of your saliva. So you can understand that if you lose this fantastic Superman of your mouth, that all sorts of bad things can start to happen without this warrior. So the direct and indirect consequence as well. When you're exposing oral tissues to drugs, that is something I'll go into more. The biological interaction of drugs, I'll go into more. The effects on the drugs on brain function. Now, I'm just going to get a little bit more information for you about that. I'm just going to go here. All right. Basically, if I can just find the right little note here, which I wrote before. So we're just going to go back to the previous slide a little bit. So if we talk about the parasympathetic system, which, if you like, is the autonomous system, which is involved in rest, digest, and calm, that effect is actually inhibited by a lot of drugs, particularly the illicit ones. Whereas the sympathetic system, which is more your flight or fight, can be increased by some of these illicit drugs. So when that happens, this can have a direct effect on the oral tissues in your mouth. The effects on brain function by increasing that fight or flight can mean that you're more likely to do risk-taking behaviour, aggressiveness, carelessness, and as a result get more traumatic injuries. These behaviours of these drug misuse can include, and often do, very poor oral hygiene. It also causes increased sugar uptake, which is due to changes in the brain and the chemicals in the brain from particularly the opioids and many others. So people tend to crave sugary carbonated drinks, and they're always got dry mouth, so they want to drink more. This, of course, involves inappropriate nutrition because sometimes they don't really feel hungry. They're just wanting to have a sweet drink. This all adds up to poor dental attendance. This is often due to a lack of access, or they don't want to take it up. It's a low priority while they're using. Most of them, even though they inject needles, have a very big fear of dentists, needles, and a phobia of being judged as a drug addict. This also can result in a delay in receiving dental treatment. And by refusal of treatment, I'm talking about refusal by a dental practitioner. Now, the reason for that is if they think that the patient still has drugs in their system, they won't want to treat them. And this is because of our local anaesthetics, in that if the drug is still in the system, that may mean that it's very dangerous for us to administer local anaesthetics containing vasoconstrictors like adrenaline, which can also acerbate tachycardia and other dangerous things to happen. That's why sometimes dentists will require people who have a history of drug misuse to get a blood test to determine their status. It also can have a big impact on the efficacy and the metabolizing of dental drugs, particularly local anaesthetics, because of the long half-life of some of these substances. And as I said, an adverse cardiac effect because of the local anaesthetic use. And this can mean that this is poorly managed and patients are always running late because time is just not an issue for them, or they have other priorities, which may be getting their next hit. So dental treatment is finicky with these people, and it is sometimes, even though they may be in pain, we need to establish that it's safe to treat them. So xerogenic patients, this is just patients with dry mouth. Now, once you lose your super saliva, naturally your risk of dental decay can skyrocket. And we can get an overgrowth of what we call unhelpful or bad bacteria like Streptococcus mutans, which is responsible for decay, halitosis, bad breath. You can get a very altered or unpleasant taste in your mouth when you don't have saliva because of the lack of lubricant. And you can also get a lot of soreness and infections with the overgrowth of bad bacteria. With this breaking down of teeth structure and inability to lubricate, it means that you can't chew very well or swallow, or sometimes even speaking becomes very difficult. The other thing that a lot of people don't realise is without moisture in your mouth, your dentures won't stick. So they're likely to be clacking up and down. And of course you get dryness of the of eyes and other mucosa as well. Lack of moisture can also mean blurry vision. Often they're very intolerant of light, and burning, itchy and grittiness in the soft tissue, which is very awful to deal with. Okay, so I'm going to go into some of the diseases because there are quite a few. There's not just one or two. I think most of you know about dental decay, but there's also diseases of the soft tissue, which is gingivitis, which is what we call a reversible inflammation, and periodontal disease, which is irreversible loss of tissue and bone. And that's a big one. Xerostomia, or dry mouth, bruxism, or grinding of the teeth, oral ulcers and infection, and also, of course, oral cancers and orofacial tissue changes. This is a little house of horrors, if you like. Sorry to do that to you guys. On the top left, and we'll talk about this more later, that's necrotic tissue on the top left slide, and that's from putting cocaine onto the gum to test for purity. So because it has vast vasoconstrictor properties, or in layman's terms, it makes little blood capillaries constrict. You don't get blood supply to an area, which is what happens when you put local anaesthetic in to keep it in the area. But over time, that tissue, because of lack of blood supply, dies. In the next slide, we've got some red gums, which is reversible, which is gingivitis. In the next slide, we're looking at the back of the teeth, and this is what we call tooth wear. You'll notice you can see the yellowness on the teeth. That's because the enamel has gone, either through erosion or grinding, and you can now see the second layer, which is the dentition. Okay, our beautiful slide to the right is probably one you see very commonly, and that's rampant dental caries. In the next slide, it's called leukoplakia, or cheek biting white lesion. The tongue, we see what we call more leukoplakia, which can be benign or precancerous. This gentleman in the middle has, this is gum disease. So you can see that the gums are receding, they're purple, red and inflamed. You can see that they look very inflamed. The teeth look long. So often people with periodontal teeth, their teeth are getting long. So they might be long in the tooth in age, but they can be long in the tooth because they've got perio. On the next slide is a tongue, and that's what we call a fungal infection. Also, the hard palate on the lower left slide is a candida, and that beautiful tongue slide, which everyone's enjoying so much, that's caused because of an overgrowth of papilla, and then tobacco, everything gets stuck and the mouth is dry. So that's very typical in a smoker's mouth with an overgrowth of papillae and then all sorts of biofilm and other things getting stuck in there. I hope that made your day. Okay, so let's get on to the direct impact of some of these drugs. So we're going to start with opioids, heroin, methadone, and of course the new one, which I don't think we see a lot of, which is the Russian one, which is the artificial. So the immediate effect of opioids is, yes, you guessed it, lack of saliva, dry mouth, burning mouth, taste impairment, eating difficulties, and a lot of mucosal infections. Also, dental pain is usually obscured because, as we know, there's a fairly short life for this drug in the system. So if you keep up with your dose, you're not going to feel much pain. Unfortunately, this results in rampant dental caries, mainly on the smooth, which is the front of the teeth, and the biting surfaces, and near the gum, obviously near the gum. That's where you'll see a lot of decay, which is yellow or brown in colour. It looks soft. As a result, they often need extractions or lose teeth, they fall out. Obviously with this comes personal neglect and of course poor oral hygiene and depression, and obviously a delay in seeking treatment. They're much more prone to gingival and periodontal diseases, oral funguses, infections, discolorations of the tongue. We do see an increase in grinding or bruxism because of the psychological problems. So in adults, grinding is always associated usually with psychological problems. And we have, of course, a heightened risk of hepatitis, HIV, etc. Unfortunately, too, when these people are on opioids, we find that normal doses of local anaesthetic fail to work. So obviously they need a lot more anaesthetic. I've treated these patients and they sometimes need at least twice the normal dose to seem to have an effect. And we get rampant tooth decay, and periodontitis is a common presentation. Also, we have anxiety, which can also reduce the effectiveness of local anaesthetic. That is true. If someone is anxious and we don't know why, people will need more local. With the chemical opioid or heroin, we find a high incidence too, other than all the others, of what we call oral necrosis of the jaw or bone. So often when these people have teeth out, the bone doesn't heal. And this is often triggered by the need for an extraction, oral hygiene, poor quality dentures, failed endo, gum disease, acute and chronic trauma and swelling. So when we do take their teeth out, we have to really know their medical history, because if they're on these things, particularly the artificial heroin, the desomorphine, they're much more likely, like people on biphosphonates like Prolia, to get very poor bone healing. Okay, here we go. The negative effects of methamphetamine and methadone. We'll go a little bit more into the difference. Methadone, unless it's sugar-free, is caustic, acidic, and a sugary syrup. It does cause dry mouth and it can cause grinding. It also can cause increased cell disruption or disruption of natural microbial defense in the mouth. And yet again, we're talking about the oral environment and the balance of the little oral environment when it comes to good and bad bacteria. Anything containing sugar tends to cause the overgrowth of the bad guys. So if you want to get holes in your teeth quickly, go on something that dries your mouth and eat lots of lollies or suck them, because that'll do it. You get a very specific pattern of dental caries, as I've mentioned, on the side and near the gum line. And this is related to, as we've gone on before, lack of oral hygiene, high sugar intake, and those drug cravings for high calorie carbonated beverages. Decreased saliva, and sometimes we find people holding methadone in the mouth to increase absorption because it's sugary. It's going to cause more problems, and psychological problems are associated with all that as when it comes to attendance, needle phobia, dental anxiety. But a meth mouth is not the same as a methamphetamine mouth. And I want to bring this out that with methadone use, with good oral hygiene, you can see that on the left, this is a person which we call has a mouth that is affected by methadone. But I'll also remind people that a lot of this damage probably happened while they were on their opioids. So it's not the chicken or the egg, it's a little bit of both. So obviously if you've been on opioids and neglected your mouth, you're not going to have great teeth. But when you're on methadone, because of its nature, unless you're getting the non-sugar variety, but there's still acid in it, you can get damage to your teeth. However, the methamphetamine users, you can see on your right, that's a pretty awful slide. Sorry about that one. That's plaque all over food, all over their teeth, you know, obviously just out of control, gross decay, severe destruction, gum disease, and overall lack of oral hygiene, making that all a lot worse. Whereas the person on the left on the methadone, to me, is obviously cleaning their teeth, even though they've got some what we call arrested decay in the dark lesions. It's obvious to me that person is cleaning their teeth. So I want to make that very clear that there is a big difference, but there are some effects that are the same. Okay, the methamphetamine mouth or crank decay. These people are much more likely to experience dental caries, 96%. 58% have untreated decay. The same rate of dental decay exists between those who smoke or snort, and a quarter retain. They also suffer from grinding, clenching, difficulty in chewing, erosion, and that can cause very sensitive teeth, rampant dental caries, extreme dryness, salivary suppression, lack of buffering capacity, poor oral hygiene and dehydration due to hyperactivity, significantly increased intake of acidic carbonated drinks, the white cola drinks in particular, which are very addictive. They often get periodontal disease because, yet again, we've got this vasoconstriction or lack of blood to the capillary network in the gums. And once you get that, that means that there is an autoimmune response in the gums, and the plaque can cause destruction of bone around the teeth, making them loose. You also end up with no teeth, edentulosum, oral ulcers and infection. It has a direct effect too on the soft tissues of the mouth, a corrosive effect because it's caustic, and the lining of the teeth and gum become raw, and that leads to secondary infections and limited ability to eat and speak. Okay, cocaine. So I think you can all guess what we're talking about on the slide here, which is the perforation of the nasal septum and palate. That's pretty awful, isn't it? And of course that then if you've got that, well, you've got real problems with speech and eating because food's going to go up there. Yet again, it's due to the vasoconstriction or lack of blood and death of oral facial tissues. And you can always also get loss of smell, or in the sense of smell, chronic sinusitis, and of course dental caries, caustic effect, as I showed you before on that slide on the gum, and also what we call tooth wear, clenching, oh yeah, good old reduction in saliva, but also burn sores on the lips and inside the mouth. And that increases your risk of transmission of HIV, candida, angular cheilitis, which is a fungus which you get on the corners of your mouth, bad breath, and of course, changes in the oral mucosa. Yet again, we have to defer dental treatment for 6 to 24 hours after the last dose of cocaine. And that is another thing. If people aren't honest with us, it's very difficult to treat them safely. Cannabis, marijuana, hashish, hash oil. So yeah, they stimulate the good old appetite, but they also, unfortunately, increase the risk of oral cancer due to the tissue change and cell disruption. It also especially increases your risk of getting periodontitis in younger adults, which is rare. So this is really a terrible thing, to get gum disease, which is normally a disease of middle or older age people, and is usually associated with genetics, is if you've got the gene and you're on these drugs, you can get it when you're very young, which means you can lose a lot of teeth as a young adult. It also can cause dry mouth and what we call leukoplakia, or white lesions, which can be precancerous. It can also cause red, and also it can cause hyperkeratotic, or an increase in keratin, so like skin tags and all sorts of buildups in the mouth. Do find a high prevalence of Candida albicans, or fungus. This is particularly when people wear dentures and don't clean their dentures daily. You can get really bad fungus in the mouth, and of course this can lead, because your mouth is very sore, to not wearing your dentures and ending up with very poor nutrition. It can also contribute to the nerve of the tooth inflaming, which is pulpitis or dying. So we do see significantly higher decay rates. We also see much lower frequency of daily oral hygiene. Yet again, higher consumption of carcinogenic or sugary beverages, and reduced oral health care, and less frequent dental attendance. Now, I want to bring this as interesting. One marijuana cigarette deposits approximately 4 times as much tar in the respiratory tract compared to a single filtered tobacco cigarette. So for me, that's really interesting, because a lot of people, my patients, say to me, oh, it's just the natural stuff, I don't have anything to worry about. Well, sorry, you do. And actually, chronic smokers of cannabis have increased risk of developing oral leukoplakia and oral cancer, fungus, and other oral infections. So I think for me, that I didn't know that until I started doing the research for this. That came very interesting to be able to tell my patients about that. And obviously, cannabis can make people experience acute anxiety about dental treatment, particularly if they're frequent users. Good old alcohol. Okay, so alcohol affects every organ in the body. And if I'm not mistaken, it's probably the one that's the big one we misuse in Australia is alcohol. So we all want to go on about ice and everything else, but wow, alcohol is a huge problem in Australia. And alcohol affects every organ in the body. So it causes xerostomia. Now, dehydrates the patient with misuse. I'm not talking about your 1 glass of red with dinner, but I'm talking if you're on the terps long term or every day, or misusing alcohol, it will dry your mouth. You will, and particularly many of the alcoholic drinks, especially these days, very sugary. If you look at all the modern kind of drinks in cans, they're usually mixed with cola or, orange sort of sugary flavors, which, young people love to drink because they don't like the taste of alcohol when they first start out. Whereas the wines don't tend to be as sweet, but the white wines in particular are very, very acidic. And well, they've got a bit of sugar. The red wines are the best, preferably my favourite, but White wines, it usually is white wines are the most acidic, followed by champagne, followed by red. But along with alcoholism, we all know we get a huge degree of neglect and personal care. Yet again, alcoholics tend to consume a high level of refined carbohydrate or munchies. And of course, a lot of them vomit a lot because they're intoxicated, which means you get a lot of acid from the tummy coming up and spraying that all over the back of your front teeth. So we also get periodontal disease because it impairs your neutrophil or your white cell, the ability to fight inflammation usually means another overgrowth of the bad guys. We get death of the white cells, which has a direct effect on the gum tissue. And we get an increase of inflammatory cytokines in the gingival crevice, which is gum disease. I won't go on too much about that. But it is gum disease is an autoimmune disease, and it is an inflammatory disease of the mouth. If you have it in your mouth, you have a huge amount of inflammation in your body. And this is what I really want to talk about is if you've got any of this going on, like particularly periodontal disease, you have a huge amount of inflammation in your body. And if you have a blood test, your inflammatory levels will show that because your mouth is the same size as the palms of both of your hands. So if you've got inflammation on that large area of your body is in huge stress to overcome that inflammation. And if your white cell count is low and you've got all these other things going on, then these diseases are going to get out of control. So everything is linked to everything else. So to me, having a healthy mouth, soft tissue and teeth means you have a healthy body. And there's many links between good oral health and good overall health, and poor gingival and oral health and poor overall health, particularly in the cardiac, tummy, liver, everything. We know, for example, now that women with gum disease, because of the inflammation, have a higher rate of miscarriage, for example. So also we get a huge increase in oral cancers, yet again, because we have the death of the white cells, and particularly we get it on the lips and the tongue because that's where we put the cigarette, or that's where we place the opioid or the cocaine. Bleeding disorders can occur. We can get a lot of damage to the marrow and liver, excessive bleeding during dental treatment because of this. And overall, the effectiveness of drugs in dentistry is diminished excessively, particularly with the benzos, because of the local anesthetic. So it means that the drugs are not metabolized as well as they should through the liver. And of course, the local doesn't work as well at the injection site because it's carried to the bloodstream more rapidly. So we have so many issues. And yet again, I stress that you need to educate your clients about going to a dental appointment when they still have drugs in their system. Oh, yum, tobacco. Wow. If you really want to lose your teeth, smoke a lot. The number of cigarettes by the years you smoke increase your risk of very poor dental and overall health. So this is just smoking on its own. It's not even if you're doing anything else. So tobacco smoking up there with alcohol causes more deaths, more chronic disease than a lot of the illicit drugs. So we've got dry mouth, we've got a lovely black hairy tongue, we get the little papilla in response to tobacco waste actually growing and becoming hairy, yum. We have slowed cell sloughing, we have food and bacteria trapped on that tongue, so you get bad breath or smoky breath or yucky breath. We've got a lot of staining due to the tobacco, and we normally get a buildup of what we call dental calculus, which is plaque that's gone hard. Yet again, we have decreasing super saliva. So chronic smokers have dry mouths, and the act of smoking sometimes can actually go the other way and stimulate saliva flow and increase calculus production, but then it slows down again and dries everything out. So it's a yin and yang. You can get an increase while it's in there, but for most of them, the mouth is very dry and dries out very quickly. We also tissues, the blood supply, because of vasoconstriction, is poor, which was often can mask gingival diseases and perio, where normally the gums would look red. They're not looking red because they're smoking, and the vasoconstriction or lack of blood supply is actually masking the disease. You also get a fungal overgrowth because of the dry mouth, and you can get nicotine stomatitis, which is that tongue. Second slide. Your ability to heal, of course, is impaired. So you have chronic systematic inflammatory response or slow healing, which can exacerbate bone loss because you're not getting blood to the bone and the gingival tissues, as I talked about before. If you're not getting blood to your gingival tissues, then you can't repair those tissues. And that's what happens in gum disease. And slowly over time, as an autoimmune result, you lose the gum, and then you lose the supporting bone around the teeth. So it can actually cause the teeth to become loose and fall out, which happens a lot. You can get delayed wound healing or dry socket, which is extremely painful if people leave our surgery and start smoking after a tooth is extracted. We'll tell people not to smoke for at least 24 hours. And often they don't do that, and then they get this horrible dry socket when none of the inflammatory response is triggered, and the pain is excruciating, and they're normally back the next day, requiring us to put in wound healing in the socket and antibiotics. You also have smokers have such a high incidence. Most smoke, a lot of cancer in the mouth is due to smoking, and you do get a lot of leukoplakia or white lesions. So just about every person I've ever seen for oral cancer at one stage was male and had a history of smoking 15 to 20 cigarettes for 20 years. That is changing as we get more women smoking. Also, we have people who have oral cancer, of course, due to other diseases, including the genital diseases, which I haven't got in the slide, I should. But other substances, hallucinogens, MDMA, ecstasy, LSD. Now, ecstasy, as a little point, ecstasy used to be prescribed as a diet drug in the 1930s because it does, of course, suppress appetite. It makes you feel so happy about things and love everybody. No wonder everyone looks so happy then. Also, there was an abundance of cocaine and other things in cough medicines as pain. So even Coca-Cola had real coconut, so things did go better with Coke. I often wonder if that's why people never seem to look like anything ever worried them during the 20s and 30s. But I do digress. So xerostomia, dry mouth. But of course, nowadays this is cut. Often ecstasy is cut with talc, all sorts of other stuff. So people don't know what they're taking. So I wouldn't recommend it now. Dry mouth, often they grind, they clench, causing very painful muscle spasms called trismus. Malnutrition, drug-induced anorexia, that's the diet drug. The clenching can result in temporomandibular joint tenderness, and that's near your ear. And often people can, have a clicky jaw or a sore jaw when opening and closing their mouths. Because of the dry mouth, yet again, we see a big increase in dental caries and also tooth wear, or from grinding or from just generalized dry mouth. So when you don't have saliva, you lose enamel. Yet again, saliva has calcium ions in it. And when you drink water from the tap, which has fluoride in it, those fluoride and calcium ions combine to remineralize. But when you've got tooth wear and you're not drinking water from the tap frequently, you'll lose your enamel because there's nothing to remineralize. And also, as I said, there's a lot of prescription medications that can cause a lot of problems. All the antis, there they are again. And antis, all the antis. I've never met an anti that didn't cause dry mouth. Please educate me if you can find one. Dry mouth can cause an antipsychotic, antihistamines, anti-HIV, anti-everything, can cause clenching and grinding. A huge increase in dental caries, gum disease, because you've got overgrowth of bad bacteria, salivary gland hyperfunction, well, that's a direct result of that, bad breath. Okay, now I'm going to move on to Aboriginal and Torres Strait Islanders and younger people. Now, this is urban. It's very different when we're talking about rural populations. But basically, Aboriginal and Torres Strait Islanders get the same oral manifestations and conditions as non-Indigenous Australians. The top issues for these people are alcohol, cannabis, and amphetamines. User rates are fairly stable, but they significantly increase for non-Indigenous Australians of cannabis, ecstasy, and cocaine. There is a huge proportion, though, of Aboriginal people who smoke cigarettes, much more than in the non-Indigenous community. And daily smoking rates have halved in young people, which is good. And there is a reduction in the use of illicit drugs, although cocaine is on the way up again. Alcohol is a major issue, and particularly binge drinking, which may cause vomiting. It does. If you binge, you drink a lot, you'll get erosion. So we see here in our little table, Indigenous smokers, wow, 43.4%. Non-Indigenous only 15%, and in young people 9.2%. Cannabis in Indigenous people 15.5%, non-Indigenous 12%, in the young population overall 25%. Methamphetamine, yeah, 3 times as much, excuse me, 3.1 in Indigenous, only 1.3 in non-Indigenous, and 2.3 in young people. And prescription meds, abuse, 7.7% in Indigenous, 4.1, 6.3 overall. Risky alcohol consumption, that is 10%, 10.6 in Indigenous communities, 6.4 in non-Indigenous, and a whopping 14.6 in young people, which is usually binge drinking. Okay, so this is our chart of disaster, if you like. Noughts and crosses, there's all the crosses. So this is a really good table, though, I think, when we're looking at particularly number 1 problem, which is dry mouth, and you can see that all the drugs affect that, which means that you get increased caries. Now, periodontal disease is associated with opioids, methadone, cannabis, methamphetamine, cocaine, alcohol, tobacco, and prescription. But only certain drugs are associated with tooth loss, and that's the opioids, methadone, methamphetamine, and cocaine. Bruxism, mainly opioids, methadone, methamphetamine, cocaine, hallucinogens, and prescription. So prescription drugs, trismus or muscle clenching, methadone, methamphetamine, cocaine, alcohol, hallucinogens. Staining, methadone, methamphetamine, cocaine. Tobacco. Tobacco is one of the worst. Black teeth,
If you smoke throughout your life, your teeth will go black. I promise you. No matter how much white glow or whatever you try and use, they will go black. Oral cancers. This is interesting. Mainly, of course, the smoking drugs. Cannabis. Number one for oral cancer, cannabis. Cocaine, alcohol, and tobacco. Now, if you combine those drugs, alcohol, tobacco, and cannabis, synergistic effect, double the trouble. Put it together, and what do you get? 1 and 2 makes 7. So, and most people smoke and drink together, which is a worry for that disease. The opioids can cause taste to be impaired. That's because of the dry mouth. That is methadone. And tobacco. Okay, tobacco. Well, we all know smokers tend to like food with more flavoring in it. That's because their sense of taste, because of their addiction to tobacco, they don't taste as many things or delicate flavors. Discoloration of the tongue occurs with opioids, methadone, and mainly tobacco, but also cannabis. I don't know why they haven't put cannabis there, because obviously that will too. Cravings for sweet food, drinks, or carbohydrates. The opioids are number one because they alter the chemical pathways in the brain. Methadone, and yeah, chicken and egg effect. Cannabis, the munchies, methamphetamine, cocaine, and alcohol. Ulcers, methamphetamine, cocaine. Bad breath. Well, I would say that bad breath is associated with dry mouth. So, but it's particularly associated with methamphetamine, cocaine, tobacco, hallucinogens, and prescription drugs because of the dryness. So look, all those, any one of those people can get halitosis because their mouth's dry, and particularly if they're not cleaning their teeth. Okay, let's move on to some nice pictures of oral hygiene. So oral hygiene advice. Now, plaque is a biofilm. Let's really talk about what plaque is, because if we don't understand what plaque is, we don't understand why we have to remove it. So plaque is a living biofilm. So a biofilm is forming on your teeth immediately after you brush. So it's like a sticky film that starts developing just after you brush it off. And little bacteria jump on that plaque, and plaque, being a biofilm, changes over time. It can ferment and change. So if you've got no saliva to wash it off and you're eating a lot of sugary foods, it can become a very acidic biofilm. So an acidic biofilm, usually after 48 hours, the plaque becomes very acidic. And what it can do is that acidic plaque can actually start to burn the enamel. So enough acid splashes on enamel, which is the hardest substance in the body, harder than bone, will mean that eventually that plaque biofilm can burn or break down the enamel. Now, when it gets through the enamel, it actually gets to the second layer, the dentine of the tooth, which is very soft. So once those microorganisms are in there, that means that you have a colonization of bacteria in your teeth. And that's what a cavity is. So these bacteria also cause inflammation in the gums. So we're not just being really dull and to tell you to brush your teeth twice a day. We're telling you to brush your teeth twice a day because that plaque biofilm can become dangerous. And people's biofilm will differ because of the environment, the microorganisms, their diet, the amount of saliva, their medications, the health of their overall body. So to remove plaque, brush your teeth means nothing. You must put the tip of the brush on the gum line and you must brush every tooth. If you get bleeding on brushing, don't stop. It's because your gums are inflamed with gingivitis normally. So just keep going. It'll take 1 or 2 weeks. If you get a lot of pain, you can take Panadol 30 minutes before, or use a Cephocane or antiseptic mouthwash to numb. Because some people's gums are so sore they won't clean them. So you do have answers to that. Unfortunately, your mouth is shaped like a cube. You have 5 surfaces and a brush will only clean 3 of them. So you do need to use floss or a little interdental brush, like a little brush that goes through your teeth. Mouthwash does not replace mechanical removal of a biofilm. Don't believe the hype. Listerine will not get the barnacles off your boat. It changes only the outermost layer of the plaque. It is not going to help you with removal of the biofilm. We do sometimes prescribe mouthwashes for post-surgery for certain dental conditions. We normally like to prescribe ones without alcohol because that people will drink it if they're alcoholic, or they can burn sensitive tissues. The best toothbrush you can get is an electric toothbrush. They are regularly on special at Coles and Woolies and Shaver Shop. I cannot tell you, some people really do not have the dexterity to brush their teeth, either due to disability or they just do not have it. So the easiest way to do it is with an electric toothbrush and sit it on each tooth, and it does the work for you as long as your tip of your brush is on the gum line. Okay. Obviously, we want you to limit sugary or acidic beverages because now you know how they affect the plaque biofilm. Now, unfortunately, we have more sugary and acidic beverages. I'm just going to have another sip of water. Obviously, talking too much. Obviously, we have a lot of sugary or acidic beverages on the market. And the worst are the black cola drinks. Obviously, this thing in my throat is not going away. The black cola drinks are the perfect way to dissolve your enamel because they contain caffeine, which dries your mouth out. They contain 10 teaspoons of sugar in every small can, and they include a high amount of acid, which gives those drinks their tingling feeling on your mouth. So if you drink black cola drinks, the last thing I want you to do is clean your teeth afterwards. Why? Because black cola drinks can soften your enamel for up to 40 minutes after consumption, and your enamel is so weakened that if you put a brush on it, you'll start eroding it. So what do? You rinse your mouth with water or drink water before and after, but don't brush. You could use a fluoride mouthwash without alcohol, or you could put some toothpaste on your finger and rub it in as an ointment. All the sugary acidic beverages are bad, but the black cola drinks are number 1 because of the caffeine. Sitting at number 2 are all sugary carbonated beverages, and these include soft drinks, sports drinks, very acidic, fruit juices, particularly citrus-based ones. Cordials are less acidic but high in sugar. Vegetable juices are preferable, cut with a little bit of fruit juice are much better, or milk-based drinks as a treat. Milk-based drinks, plain milk is best, but if you're going to have a treat, I would probably recommend a milkshake over a Slurpee as another one. Slurpees are $1.99. Really cheap, really bad. Water is a drink of choice, particularly water from the tap. Use a fluoride toothpaste. Your herbal toothpaste will not help you. Sorry, it sounds good, it sounds natural, but you need fluoride in your toothpaste to repair all those acid splashes on your teeth. It's the only thing that will remineralize enamel that's been damaged by acidic plaque. So, yes, you might like to use a herbal toothpaste. It won't help you. Healthy diet obviously is a big one. So you want a balanced diet. You want to avoid highly processed food, which usually contains loads of sugar and acid, and a lot of canned food does too. So if your mother doesn't recognize, grandmother wouldn't recognize it, it's probably not worth eating. I'm not saying you can never have it. Not doing the Willy Wonka dentist father story here, but it's a balanced diet, and these sugary treats should be treats. Children should not be introduced to sugar before the age of 2. If you do want to have something sweet, I'd recommend blueberries or strawberries, which are fairly low in sugar. They feel very refreshing in a dry mouth. And of course, dairy, which is very protective because it has casein in it, which is occurs in milk, and hard cheese is a thing that actually protects teeth, acts like a film. So white wine and cheese, yum. Now, so tips for managing a dry mouth. You can never drink enough water if you've got a dry mouth, and people with dry mouth will sip on water, but do avoid sugary beverages and rinse with water after meals. You can replace missing saliva with salivary substitutes. I'll go through some of those. Use alcohol-free mouth rinses or moisturising gels like GC gels. A lot of our irradiated patients as well, we use saliva substitute. You can stimulate saliva with sugar-free chewing gums. Let me give you a warning on that though. Do not consume the whole pack. All right, okay. It can cause more than one tap per hour can cause a freeing up of the nether regions, resulting in a lot of toilet visits. So personally, you have been warned. Sorbitol and xylitol do not consume in large amounts is written on the packet for a very good reason. You may not be seen for the rest of the day. Dry mouth gum or drugs that stimulate salivation, if advised by a specialist. There are lozenges you can get. Always take water or non-alcoholic drinks with meals and avoid dry or hard crunchy foods. I guess what they're talking about there is, yet again, if you've got no saliva, then you're maybe going to gag on that. But you can drink water with that to help form a bolus and chew and swallow. If you're very dry in the mouth, spices and chili can be very unpleasant. But if you can avoid anything that may worsen the dryness, such as drugs, unless they are essential, alcohol, including mouthwashes, smoking, tobacco, other substances. Now, caffeine, here we go, coffee, Coca-Cola drinks. So coffee is another issue. If you drink a lot of coffee with sugar in it, bad news. You're creating a very acidic environment in your mouth. Because like the caffeine cola drinks, you got caffeine as a diuretic, making you go to the toilet, making you feel thirsty. And if you've got sugar in that, you're creating a very dry environment. So people that drink hot sugary coffee or tea all day can suffer with very high decay rates and dry mouth. So yeah, everything's a drug, isn't it? Coffee, tea, alcohol, everything. You can protect against dental caries by avoiding frequent sugary food and drinks and by keeping your mouth very clean. And it also goes through using a fluoride toothpaste gel or mouthwashes, but you have to use a mouthwash with that. Please have regular dental checks so I can see you before it gets out of hand and you require an extraction, and you can protect against a lot of soft tissue problems. Now, rinsing twice daily with chlorhexidine, I would take that under advisement from a dental practitioner. That would be in a mouth with very high decay rate or special needs. Chlorhexidine can stain your teeth very badly. There are non-staining ones. Please clean your tongue. You can buy a tongue scraper, or you can brush it with your toothbrush and rinse it, because then you stop that build-up. And keep your dentures out at night and disinfect your dentures in some Miltons or something like that at night to stop candida. Okay. Tips for methadone users. you do need to visit the dentist for a full checkup, even if you have no teeth. That's because we want to check, as I said, all the soft tissue areas of your mouth. Use sugar-free methadone. So it is available, and it does help a lot if you don't have sugar in there. Brush your teeth for 2 to 3 minutes with fluoride toothpaste before and after treatment. Well, I'd rinse first and then I'd brush. I'd probably wait a little while, but spit out after brushing, don't rinse. Give yourself a fluoride treatment at home. And that's often a good thing to do before bed. So if you're brushing your teeth, don't spit out the paste. Leave it on your teeth overnight as a treatment. And do not use mouthwash unless advised by your dentist. Dry mouth, drink lots of water, sugar-free gum. Methadone may cause sugar cravings. So choose healthy sugar-free snacks and drinks. Best drinks are milk and water. Drink tea and coffee without sugar. You can still have milk. Avoid the fizzy drinks. Try to eat more fruit and veg. If you smoke, try to stop. I'd really emphasize that we do a lot of smoking cessation. And if you drink alcohol, try and reduce the amount. Free dental care is available for all pension, health and senior card holders in Queensland. This is through the different health service districts in Southeast Queensland. Obviously, we're in Metro North here. We do offer emergency and general treatment through the call centre, and we do offer specialist treatment such as dentures, crown and bridge, and treatment of periodontal disease. Of course, there are wait lists. Now, you have to be on a general wait list before you can get on a specialist wait list for a denture. You can get emergency same-day appointments. I've given the number there, but just remember for same-day appointments, emergency, those tips I gave you about when was the last time you had drugs. If you're still intoxicated, we probably won't be able to treat you. We are going to try, these are our references for more reading, which are available, some great articles. I learned such a lot. And thanks for joining us today, and have a fabulous Christmas. Wishing you all the best.
Thank you very much indeed, Mary. I think that's a very practical presentation, and it's very clear that you're passionate about your topic. You might want to stay here because I've got a few questions, if that's okay.
Yeah,
with you,
of course.
Time. So thank you for everyone that put the questions in. Thank you for seeing us through to the end. Apologies for those that had to go away. Remember, it will be uploaded onto our website, so you can come back and revisit it. So I think you've answered some of these, but I'll go through some of them anyway. With so many toothpaste varieties on the market now, you see a whole shelf.
Yep.
Is it worth paying the $15 ones, or is it just anything with fluoride?
Okay, this is a great question. There are many different types of fluoride in toothpaste. There's not just one. Now, a lot of people that come to see me have specific needs. There are toothpaste, as you probably are aware, for sensitive teeth. These are excellent products if you have erosion or sensitive teeth due to medications, because these toothpastes like Colgate Relief and Sensodyne do contain ingredients that will stop the pain. So there are many different ones you can get. The rapid one by Repair by Sensodyne will almost have an immediate effect, but you must keep using this toothpaste. You can't switch between them. The reason is that they have different ingredients which build up in the teeth, or the little nerve endings in your teeth, and actually stop those nerve endings sending signals of pain. So if you have a high caries rate, which a lot of these clients will, we sometimes put people on a very high strength fluoride toothpaste called Nutraflor 5000, and that is only dispensed at pharmacies. But we use a tiny amount and it's left on the teeth overnight. But generally, you'll want a toothpaste that contains fluoride in it. Avoid toothpastes that are very abrasive. I would stick to the brands like Colgate, Oral-B, well-known brands with scientific research. Don't go to the white glow immediately. It might promise you the moon, but believe there's bleach in there. So if you've got sore teeth, you certainly will have even sorer ones after bleaching them. So a lot of those bleaching agents can cause very sensitive teeth. So it's best you go to a dentist to have bleaching.
Perfect sense. building on from that, somebody also asked, you mentioned that an electric toothbrush is obviously the best form of getting your teeth clean. Do you think there's any benefit? You know, you get these sonic ones. Is there any
No,
benefit to sonic over electric?
no, there's no benefit to sonic.
Okay.
And most of my customers who buy them wonder why the hell they did. So, but an electric toothbrush, because it has oscillating bristles going at, it's a German design, Oral-B, that means that they're technically designed that they remove plaque for you much better. You need to place them on each tooth and let them sit there for about 5 seconds, but their removal of plaque due to the oscillation of the brushes is so superior.
Cool, thank you. When we were talking about the cannabis, the issues associated with cannabis, somebody's asked, and I think I would have an idea on this, would using cannabis in an oil form, so under the tongue, for example, would that be better than smoking, do you think?
It is better. Anything's better than smoking. All right. Okay. So anything that's not smoked is preferable. Yeah. And of course, there's medicinal cannabis, which is used without much side effects safely. So
smoking is about the only route that isn't approved for medicinal use.
Yeah, exactly. So so look, I can do a bit more research for you on that. I'm happy, and I think it's in probably one of these articles.
I put a link to a research article in the chat forum, so by all means, guys, jump on that and have a look. Really useful question here. Do you know if there's any patient literature, patient information about the impact of the drugs that some of our clients might use on teeth?
There's plenty of literature on dry mouth. I think we need to do specific pamphlets, just like the slides I've shown you today.
Right.
So I'm going to suggest that we do a pamphlet based on what some of the things I've presented in this chat today, because I think that it would be of value for everybody. I think that's a really great suggestion, and we should do it.
I agree. Bruxism is a common thing amongst many of our clients. We've already spoken about, the people that use methamphetamine, but even in mental health. It's a medication or what. Bruxism was common. What can be done to reduce the future? If we know that somebody has bruxism or is grinding, what can we do to try and reduce further damage? Is there anything that...
Yes, you can. Number one, this is a multifactorial issue. It can be your brux too, because you're a snorer and you don't breathe through your mouth, which means sometimes a sleep test is a good thing. Also an ENT checkup, and then also maybe a splint could be made that you wear at night on your teeth to stop it.
Yeah, my wife wears one of them.
Yeah. So there are, depending upon what the actual cause is, if it's just drug related, maybe a splint.
I'm hoping my wife's isn't drug related, but who knows?
No, if we're stressed, I clench. I mean, I clench at night and I wake up and I'm sore here.
I think hers is an anxiety.
Yeah, it's very common.
Yeah. You mentioned about methadone, and we know that there's a biodone, the sugar-free version. In your research for this, did you find anything suggesting whether, because obviously a lot of the damages you've mentioned in your presentation might have already been done. Is there actually any benefit to having a sugar-free one, or if you use the sugar one and then rinsed your mouth after?
No, I would go for the sugar-free.
Okay. Because
it's sticky and it's another sweet thing in your mouth, and it'll stay on your mouth. And if normally you're not going to go straight home after it. Yeah. So I would recommend always a sugar-free one over it, because you're not got that bacteria then going, yippee, sugar, because that's what happens. So the strep mutans in your mouth, when you've got sugar in your mouth, go, yes, this is my food, I can grow quickly. So yeah, sugar-free is much preferable.
Perfect. And the final question I have is actually, nicotine seems as if that might have a drying of the mouth.
It does.
Smoking. So when somebody's using nicotine gum, does that?
No.
It's okay?
Yeah, it stimulates saliva.
That's what I thought, but I'd consider chewing.
And you know what? A nicotine or pure inhaler of nicotine to deliver nicotine or gum or a patch, no ill effects at all. It's not the nicotine, it's the smoke and the other carcinogens. So nicotine itself in its purest sense is not the issue.
Yeah,